Good evening, everyone. Welcome to Locum Optometrist Rates, which locations pay the most. This is an eagerly anticipated webinar, and for Located Locum, we have over 170 people registered and attending the webinar. Rates is always a hot topic within the healthcare industry. So hopefully today you're going to get a lot of value out of this, and you're going to come away with more knowledge about the different rates you can expect as a locum optometrist. Just a bit of housekeeping before we properly get started. We're obviously live here on LinkedIn, so if you have any questions, you can just pop them in the chat below, and we will get to them. If we don't reply verbally, we'll reply via text just underneath your comment. So I'm joined here by Sammy Chan. Sammy, do you want to introduce yourself?
Yes, so yes, I'm Sammy. I cover the optometry sector in Located Locum. So anything from you getting things with your account sorted or even booking shifts, that I'm the guy.
Yeah, he's definitely the guy. So yeah, Sammy will help with any queries around optometry. He can give more specific answers than me. I'm Stevie McIntyre. I'm marketing here at Located Locum. As a team, we have helped over 20,000 healthcare professionals find temporary and permanent work over our existence as an organisation. So we think we're well placed to talk about temporary healthcare opportunities, and we're especially well placed to talk about rates. So without further ado, I'll get started in the presentation. So what are we going to cover today? So number one, we're going to cover factors that impact rates. So that's looking at different things that actually make rates fluctuate. We're then going to look at our rate study and locations with the highest rates. We're then going to talk about negotiating rates, and we're going to provide some tips on how to negotiate ways that you can get the best rates, and just some other little insider tips from the industry. If we get time, we'll touch on stayaways and relocation. We also might cross over that into talking about rates, because you might notice there's different areas with different rates whenever we get into that side of the study. And then we'll also do a Q&A whenever we are at the end. And like I said, if we don't verbally do the Q&A, we'll definitely get back to you via text. So make sure you fire in as many questions as possible for us. So what we always start webinars with asking, what do you want to get out of this webinar? The reason we do this is that this dictates sort of the content of the webinar. It also tells us if we're along the right tracks with our promotion of the webinar and our attendance, because there's no point you join the webinar and it's not really what you expected. So it helps us refine what we do our webinars on. And if you've got any suggestions for future webinars or things you'd like to know about the industry, definitely pop them in the chat box. So just while I'm talking, if you put into the comments, what do you want to get out of this webinar? Do you want to find out about rates? Do you want to know the market rate sweet spot for your region? Do you want to know the highest rate, lowest rate, where the best regions are for rates, where you should go to work a shift, or do you want to know how to negotiate? So fill in whatever you want, free text, just chuck in whatever you think, and we will get to it at the end of the webinar, or we'll come back via text as well and just follow up if you see what you're interested. So who are we? Like I touched on this just briefly before. Who are we and why are we doing this webinar? So we are Locate a Locum, and our mission is to mobilize the world's healthcare workforce, and we do this by getting the right healthcare professional in the right place at the right time. We're an award-winning platform, and we've been in existence since 2016. We're now used by over 25,000 healthcare professionals across the UK and Northern Ireland. And we're used by 8,000 healthcare organisations to find temporary healthcare workers. So how it works is the organisations post the shifts, and our technology solution displays those shifts to the healthcare workers, and you use technology to apply for those shifts, and then you're booked in under a minute in certain occasions. We're really happy to say that we're also the top rated locum app in the UK. We've got over 100 5-star reviews, so I think that speaks volumes about the service we provide, and also our technology solution that our development team have spent a few years in developing. So that's just a little bit about us and why we're placed to do this webinar. So we'll just jump straight into rates. This one is quite, this sort of is a background to why we're doing this webinar. So we always get questions about rates. First question we always get is who sets the rates? And that's a really easy answer for us. So the organization sets the rates. Located Locum is a technology platform. So we give the ability for organizations to use our technology to post shifts out to a marketplace. With this posting comes setting the rates. So the organizations post the shifts, they set the rates, so they kind of dictate the rate for that region or area or city. But there's some other factors that influence rates as well. So the supply of locums is number one thing that impacts rates. What we've seen over the last 2 years is COVID-19's impacted the number of optometrists that have sort of been added to the register or qualified as optometrists. Luckily, this is starting to subside now. In the last few months, we've noticed that it's sort of getting back to normal rates of people signing up and registering for our platform and across the industry. Another thing that's impacted rates is pent-up demand for annual leave from permanent optometrists. Just to give a little bit of flavour about this, what we mean by this is that obviously throughout the COVID years, as we all call them now, no one was able to travel, so that meant people weren't taking leave. Organisations then rolled over the leave that permanent staff were able to take, and now that there's a pent-up demand for that leave, so if an optometrist maybe didn't get leave last year, they're maybe taking a longer period off this year, which is meaning that there's more demand for locums, and in turn what that does is push the rates up. And leading on to that, generally in this type of industry there is a supply and demand model. So the demand is the organizations who want locums, supply is the amount of locums there is. And although this is a generic thing to talk about, it's probably one of the biggest contributing factors for rising rates. And the data supports this. So when we look at regions such as Inverness, which is close to the Highlands in Scotland, we look at regions like that don't have a lot of optometrists, locum optometrists. Whenever there's a vacancy for a locum optometrist or a vacant shift, the rates are generally higher because there's less supply and the supply doesn't match the demand. So what you'll find is in less densely populated areas, there's more demand for locums and less supply of locums, and rates will generally be higher as a rule. Sometimes this doesn't always come true, but we'll look at our data coming up, and this will give you a little bit more insight on how this works. So what do we do at Located Locum in terms of how do we get these rates and how do we get these studies put together? So what we do across optometry and pharmacy, the industries that we work in, is we look at all the data that comes through our platform, and we look at the booked shifts, and then we work out an average rate by city. And this allows us to look at trends by location. So for this study that we've put together for this webinar, what we've done is we've looked at booked shifts through our platform from the 1st of January 2022 to the 30th of June. So this has given us sort of a kind of seasonal look at the rates and different trends and if things are moving up or where the average rate is by location. And just to give it a bit of context, this is a combination of around 10,000 shifts that we've looked at in order to gather this data. So we're going to jump into it and we're going to give the average rate for the whole of the UK, and then we're going to look at the highest rate, the highest city, the lowest city, and then we're going to look at some cities across the UK and their average rate and sort of discuss reasons why this might be. It's a nice graphic we've put together for the study. Particularly proud of that one. But if anyone has any questions when we're going through this, pop them into the box. Or if you want to know where the rate for your city that you're located in, put it into the box and we'll be sure to, if we don't have it listed, we'll be sure to come back to you separately and give you that rate, that average rate. So here we have it. The UK average rate is currently sitting at, for January to June 22, is £435.64. It's important to note the methodology around this. So what we did is we looked at the day rate and then we broke that down by hourly rate, because obviously there would be some days that maybe be half day. So we didn't want to include that because it would skew the data. So we looked at full days only here, and that was like multiplied out by the hourly rate. So 8 hours is a general shift. So we multiplied the hourly rate out by 8, and then we divided it by how many shifts there were in total. So £435.64p across the UK. But you can see on the right here, there's quite a big fluctuation between the highest average day rate by city and the lowest average day rate by city. So the highest average day rate was £517.50. That was in Reading, and the lowest day rate average day rate was £290.40p, and that was in Leicester. So it's just interesting, you're seeing here two different cities in two different parts of the UK, one's in the Midlands, one's in the south, and you can see the fluctuation, and like there is factors that will influence this. This one factor that we haven't talked about that could influence this is like the recency of when the shift is posted. So for example, in Reading, if the shift was posted on our platform a day before it was due to be worked, the rate would typically be higher because that would be an emergency rate, and that would then fluctuate this rate study and see that the rates would be higher. Does that make sense, Sammy, what I'm saying here?
Yeah. So yeah, emergency shifts are always going to be high. If it's the day before, even during the day. In Leicester, I said there's a few more locums in Leicester that will be Reading, which is why maybe the rate in Leicester isn't as high, although there are a good amount of locums sort of in both areas.
Yeah, definitely. And I would say again, like this is the average rate, so there could be a fluctuation between, if you broke it down, you looked at the highest in Leicester, it'd be probably a lot higher than 29 or 290.40. So that's the average. It's just important to note that. And we can do a study where we pull out the highest booked shift, for example, and that could be completely different. We do that every year. We pull out the highest rate shift across the whole year, and it could be that is in somewhere like Leicester, where it could stick the trend and say it be down south and be in Reading, for example. So we'll do that. We'll do that study, and we're happy to sort of share that in the future. So that's just interesting, and I can see some comments coming through from people on the webinar, and like I say, we'll get back to you with your city's highest and lowest rates as well. So this is just a quick look at 5 cities we've pulled out throughout the UK, and just to look at the average rate in those cities. So we've ranked this from high to low in terms of just cities, and we wanted to create like a good spread of cities. So as you can see here in Yeovil, we've got 426.40. And again, like that follows trend. There's not a huge density of optometrists in Yeovil. So whenever a vacancy arises, typically the demand's higher and the supply is lower. So there is a higher rate in order to generate the locum. Sammy, would you see people travel to go to these shifts in sort of more remote or less populated areas?
Yeah, absolutely. So, say for example, London there, that doesn't really follow the trends. With loads of locums there, but that does include Greater London. So, the outskirts of London there, may not be as many locums. The likes of Reading, which is the highest city, in rates, it does kind of follow the trend in that sense. But yeah, if you say you are living in London or Birmingham, Leicester, maybe the rates are going to be lower in directly in the centre of the city. If you are willing to go a bit further out, which a lot of locums are, there's where you'll find the increased rates.
Yeah, definitely. And yeah, Sammy's right. The London figure includes Greater London. So the way this is done is it's a radius. The search is on a radius around London. So you'll pull in shifts there that are potentially just outside London, but it sort of breaks it down by city, and the same methodology is used for each city. So hopefully it's a sort of fair test when it comes to that. Yeah. So just going through, like you can see the spread of different rates. And like I said, we've only got half an hour here this evening, so this is really just a quick glance at this and to provide you with the insight of our methodology into this. So this kind of shows that the data going through our system, we can help in terms of predicting rates and looking at rates, and we can look at trends coming in, looking into the future. So yeah, hopefully that's interesting for everyone. And I'm aware here we don't have any Northern Ireland or Scotland rates in. If anyone would like those specifically, again, reach out and we can pull those out for you. So moving on, So this is just a slide on sort of keeping and finding work. We talked about a lot about rates, but what we would like to say is that you can use our platform in order to keep and find work, and the more up to date your profile is, the more likely you are to get shifts when you apply. So we're going to move on now. We skipped over that slide quite quickly, but we're going to move on to top tips. So I'm very conscious of the time, and there's some absolute gold in here. And Sammy and I are going to talk through some of this. So Sammy, know your worth and what you bring to the business. So how would you translate that into sort of an actionable tip for a locum?
So this is really just knowing what you can do as a professional in the optic space, whether you're optometrist, CLO, DO, domiciliary. What equipment can you use? How does that benefit? As a locum, obviously that will be very beneficial with if you can use multiple equipment or multiple types of equipment. How flexible are you in terms of if you need to move to a different practice before the shift. All of these things will show your worth and what you can do for that company, whether it be boots and independent Specsavers, what have you. Our app does help this. That allows you to select what types of systems you know how to use, and obviously with the app you can decide when you want to work and how you work. You also just let me know and I can translate that into the companies.
Yeah, brilliant, Sammy. I think that's a really important one. So Sammy kind of reinforced it there. Having like an up-to-date profile on an app sort of puts you in the best foot forward in terms of getting a good rate and things. So it's just important to keep that up. I think that's just a little reminder to make sure that everything's up to date. And then the next one down is know the average rate in your region. And I suppose, Sammy, this is kind of what we just talked about. Like our platform gives the insights into the average rate. So like when you're looking back at book data, you get a feel for what sort of rate to look for in a region. And how would that kind of translate through to an actionable tip?
So it's really down to use a locum. So whether you are an experienced locum or maybe you're new to the optical space, I would recommend doing a bit of research on what rates there are out there in your area. What you want to travel to. You obviously don't want to undervalue yourself, but at the same time, just as importantly, you don't want to over ask. So sometimes it can be a bit difficult knowing where to find the rates and what the average is, but we're always here to help. If you do have any questions, obviously fire them down below, or you can contact us directly.
Yeah, brilliant. And I think the third point down there is just exactly the same there. I think make sure you're clear in advance on what you will and won't do. I suppose that's dictated by the rates, like looking at the average rate. I suppose you're not going to pitch over £200 a day over the average rate, because that would be unrealistic. So I suppose, yeah, we'll skip over that one. The fourth one down there is set a maximum of appointments and make sure start and end times and break times are clear. Sammy, that's probably more sort of looking at reading the shift notes and making sure you know kind of what you're getting into before booking.
Yeah, I mean this one's pretty self-explanatory. Yeah, it is really just knowing what you are going to do. And what we would highly recommend is really to give the store a call, before you apply for a shift or even after. Find out, what's really getting on. Get that clarity, of whatever store you're working in. Whether what equipment they have, what the testing times are, and all the information that you want to know. You obviously want to find this out before you come into the shift, just so there's no surprises or anything like that.
Yeah, brilliant. And then the last one here is get terms in writing. So what that is actually saying is use technology to book a shift. Once you're booked into a shift, there's an electronic stamp, obviously with technology, that there's no argument on the rates, or there's going to be no conversation to have that you were booked for a certain rate. You find this in WhatsApp groups and things whenever people are booked through those. Often people have to go back and see what rate they were booked for. But with technology, for example, with our app, you could look at all your booked shifts and you can actually see the rate there and then that you're booked for. Sammy, would you kind of echo that? That would be an important thing.
Yeah. So with the Locum app, whether you apply for a shift or you've been booked for a shift, it's physically there on your profile. There's no arguments to what times you're starting at, what rate you're booked in for, what date you're booked in for, and as well as that, you're going to receive notifications and emails leading up to that shift. So there's no chance of anything really going wrong or any negative surprises.
Yeah,
Um,
brilliant. Yeah.
it does work so much better just than agreeing on the phone or WhatsApp.
Yeah, no, 100% agree with that. And that is, as well, I think post shift as well, you get sort of a paper trail of what shift you've been. So like, and I know in the diary, a lot of the optometrists like the diary feature, so they can look back retrospectively on how much they've made per day, for example, and then they can look at it as a monthly view and see, oh, I'm due this amount of money, and it stops that whole like chasing invoices or going through WhatsApp groups saying, especially if you're not the type of organized person who like documents everything. Okay, so brilliant. They were good tips. I think now we're just going to have a wee look at the app. Maybe we should have moved on to this one a bit sooner. I'm very conscious of time here. We're getting through the time rightly. But just this is quickly just to show how the app works and the Locum app. So as you can see from left to right, we mentioned there, so you get an oversight of where the shift is in terms of the little map. You get the date, the hourly or daily rate. You also get the times, the shift times Sammy's just mentioned. You get the breaks. For example, we just talked about that. Are breaks paid? Are breaks not paid? You can see on the app if they are or not. And you also have, you can't see here, but you can have shift notes as well. So that's going to give you all the details of testing times, equipment you need, anything like that, or if it's a busy store, for example. And then this is the bit that we kind of want to talk about. On the Locum app, you have the ability to apply for a shift, and that sends the application straight through to the employer, or you have the ability to negotiate a shift. And what that does is gives you the ability to send a proposed rate through the employer, and they can either accept or decline that rate or renegotiate the proposed rate. So that kind of takes the whole telephone ping pong away. So in the past, what would have happened would be you would have phoned Sammy, for example, and asked for a new rate. Sammy would have phoned the shift coordinator and asked for that rate. The shift coordinator would negotiate. Sammy would then put the phone down and phone you. So you can see kind of quite quickly how like that'd be quite time consuming for anyone involved. But this kind of takes that all away. We feel like it's kind of the future of work in terms of how shifts are negotiated. Anything else to add to that, Sammy?
I would like to mention one thing. So I know a lot of optometrists, but a lot of people in the optical sector, they do work off the daily rate, and you may see that it is down as an hourly rate there. That's primarily just because our initial go ahead into the field of healthcare is pharmacy, which is they work on a daily rate. But there is an update coming quite soon that will show you the daily rate as well as the hourly rate, or as well as the daily rate. So you will have both.
Okay, cool, brilliant. Yeah, completely agree, Sammy. So new slide. Yeah, I think this is just kind of what we talked about, like just using technology to negotiate. And these are the benefits. I'll leave this up here just for 30 seconds, so you can just have it in text what we just talked about. But really, yeah, we'll just be reinforcing everything we've just said in terms of use technology. It reduces your admin time. It makes the organization of your work and life so much easier, and you can have your full work schedule in your pocket on your mobile phone at all times. And there's sort of, I think Sam used a really good word. There's complete clarity in terms of what you're doing on a daily basis or weekly basis or monthly basis. So yeah, hopefully that's long enough for everyone to have a look through those. So what does the future hold in terms of rates? We can't look into a crystal ball here, but we can tell you kind of what's happening in the industry and what we potentially think could happen. So I'm not sure if people are on this webinar have heard this term, but it's the most candidate-driven recruitment market ever. And temporary vacancies are up 79%. So what the reason for this is because more people are doing contract work. Now, this isn't just in optometry, this is across all industries. More people are sort of valuing their flexibility against permanent work. So what could happen here is you could see more locums, which could push the rate down, but also you'd see less permanent staff, which could push the rate up. So kind of might even itself out. It's hard to predict how this will go in the next year. People might want the security of a permanent role because of the whole cost of living crisis. So this percentage of people working temporary may come down, may go up. But it's just the highlight now. We're in a candidate-driven market, which means that the power is in the worker's hands and not the employer. And then there could be more supply and more optometrists being registered or coming through university. So that again could push the rate down slightly, and less demand as well. So generally isolation is going to become less frequent. So the isolation times for COVID isolations, for example, are reducing, and also hopefully COVID cases will decline over this next year. And we will see less and less isolation, so there will be less demand for people for temporary workers, which is interesting. But overall, it's probably going to remain pretty consistent, unless there's anything major that comes along down the line. Just judging by the things that are happening in the industry, and I think the cost of living crisis is going to have an impact in terms of more people working permanently and wanting that security. But you never know. You never know what might happen. So hopefully, that very vague there on the answer. But hopefully these factors anyway, if you take them into mind, you can kind of draw your own conclusions. It'd be interesting to see if anyone who's on the webinar wants to make a prediction about the future. Don't worry, we won't hold you to it, but it would just be interesting to anyone who could make a prediction and think what they think is going to happen. And we might even do a little survey after and see what all attendees think. So that'll be interesting. It could shape future webinars as well. So yeah, moving on. Resources. We talked a lot about the rate study today. We aim to have a full study done. Probably wait till we get a little bit more data in terms of maybe at least 3/4 of data. Just that gives a more accurate view on the rates and things. And then we'll send out the full methodology and data breakdown for you to all access. And what that'll allow you to do is look at your city. So what we usually do is look at the top 50 cities in the UK by population, and then we put the average daily rate against those based on our data. So if you want this to your inbox whenever it's ready, just comment below, and we'll come back to you and get your email address, and then send it over to your inbox straight away as soon as it's ready. Yeah, so that's kind of where we are, and then. Yeah, for any employers who are on here, again, the market rate data is really important for helping you set rates. So yeah, reach out as well if you're interested in any more information about the methodology of this. And yeah, we're pretty much done for time. I don't think I'm going to get a chance to get through the questions verbally, but like I say, hopefully during this webinar, one of the teams coming back to you on that. And replying to the questions. So someone should have been moderating this and coming back to the questions. If they haven't, we'll do it after. But all I'm left to say is thank you very much for attending. Went through the time pretty quickly there, Sammy, didn't we?
Yeah, mostly past it, kind of flew past it there. But yeah, like just to reiterate, mostly said, if you guys do have any questions, maybe these questions come up later, don't hesitate to give us a shout. We're available for you.
Yeah, brilliant. So yeah, without further ado, we really thank you all for attending the webinar. It's really good numbers on tonight's webinar, some good interaction. Yeah, so we're looking forward to see if any of those predictions do come true. But thank you all for attending. We know you're busy, and we really appreciate it. And if you want any, if you have any suggestions on how to our next webinar, let us know. Okay, so I'll just close off now. Thanks. Good night.
Good. See you.